What if deliberately taking in a little of someone else's pain could actually make you less reactive, more resilient, and better able to help? Welcome to Beyond the Mind. Today we explore a practice from the Tibetan Buddhist tradition called Tonglen, literally, sending and taking. We will teach it as a practical, trauma-sensitive method for training compassion, reframing suffering, and shifting habitual reactions. Along the way, I'll weave in a clinician's story of caregiver burnout, an accessible account of why Tonglen can change how we respond to pain in ourselves and others, and a 5-minute micro-practice you can use tonight to start shifting your relationship to difficulty. This is a full, measured exploration. Historical context, psychological and neuroscientific perspective, trauma-sensitive instructions, a guided 5-minute compassionate breathing practice beginning with self-soothing, troubleshooting, and an evidence-friendly roadmap for integrating Tonglen into daily life. If you want the downloadable one-page protocol or a voice-ready MP3 of the guided practice, note protocol in the comments and I'll add the link. A story first. Names and identifying details have been changed to protect anonymity. Dr. M is a palliative care clinician in her late 30s. For years she loved her work. Profound human contact, a sense of meaning. Over time, the emotional intensity wore on her. She noticed a hardness in the way she spoke, a narrowing of curiosity, and a rising impatience with family members of patients. She began having trouble sleeping. She tried conventional self-care, exercise, therapy, structured breaks. Those helped, but the pattern of emotional exhaustion returned whenever demands spiked. On the recommendation of a colleague, Dr. M began a brief course in compassion practices and, hesitantly, she tried Tonglen. She began simply, a 5-minute breath practice each evening where she first soothed herself, then practiced imagining receiving a small portion of suffering, and then letting a sense of warmth go out to others. Over weeks, she reported 2 shifts. First, the raw edge of reactivity softened. She described it as the volume knob coming down. Second, she reported a steadier ability to be present without becoming overwhelmed. She could listen to patients' stories without the same automatic contraction of her chest. Over months, she resumed clinical work with a renewed sense of equanimity and clearer boundaries. This is not an exceptional miracle anecdote presented as proof. It's an invitation. Tonglen can be one practical lever among many for changing habitual responses to suffering. Throughout the script, I'll be careful about scope and safety. Tonglen is not a replacement for trauma-informed therapy or professional support, and it must be practiced mindfully, with appropriate pacing and choice. What is Tonglen in plain terms? Tonglen is often described in Tibetan lineages as an exchange practice. On the in-breath, you take in the suffering or difficulty, not in a literal, egoic way, but as a trained imagination and attention that turns toward pain rather than away from it. On the out-breath, you send out relief, warmth, healing, or whatever would reduce suffering. The basic cycle reverses the usual defensive habit. Where we normally recoil from pain, Tonglen deliberately cultivates a trained openness that allows us to encounter suffering and then respond with a heart-directed intention. Traditional teachers emphasize that Tonglen is an expression of bodhicitta, the wish to awaken for the benefit of all beings, and it's typically taught in graduated steps, from practices focused on oneself to loved ones to strangers to difficult people and finally to all beings. Modern teachers often present Tonglen as a skillful method for developing empathic resilience, the capacity to be present with suffering without becoming emotionally overwhelmed. Why is this practice relevant now? Caregiving professions, health work, social services, and many modern roles require repeated emotional exposure to suffering. Our brains evolved to react to threat with protective contraction and avoidance. These responses are useful in acute danger, but when the environment continually presents emotional stressors, repeated contraction can produce chronic sympathetic arousal, empathy fatigue, and burnout. Practices like Tonglen offer a training regimen for attention and motivation. They repattern how we relate to suffering. Instead of escalating avoidance or numbing, we learn to approach pain with skillful intention and regulated physiology. A brief, grounded neuroscientific frame. I'll present this briefly and cautiously. Contemplative practices interact with complex neural systems, and research is ongoing. Contemporary effective neuroscience distinguishes between empathy and compassion in useful ways. Empathic resonance often involves sharing another's distress and can increase personal distress and anxiety. Compassion, by contrast, is associated with an orientation toward alleviating suffering and can recruit caregiving and reward systems that support resilience. Compassion training paradigms, sometimes including elements like Tonglen, have been associated in multiple studies with increased positive effect, improved emotion regulation, and changes in brain circuits involved in affect and social cognition. Neuroimaging work suggests that compassion practices can engage brain regions linked to caregiving motivation and positive effect, and behavioral research has found changes in prosocial behavior after compassion training. These findings are promising but not deterministic. Individual responses vary, and context matters. If you want a short reading list for the scientific background, I'll include selected sources in the description and pinned comment. Trauma-sensitive framing, key principles. Before we get to the practice, 3 trauma-sensitive guidelines are crucial. Choice and agency. You always choose the scope of the practice. Tonglen can be done in imagination with metaphor or using indirect objects. You may begin with small, clearly contained forms. For example, working only with your own mild discomfort or with a symbolic image, and expand only as you feel safe. Grounding and regulation. Prioritize bodily safety. If your nervous system is alarmed, intense panic, dissociation, or overwhelming flashbacks, stop the practice and use grounding techniques. Connect with breath at the natural rhythm. Feel feet on the floor. Orient to the present room. Tonglen can increase exposure to difficult feelings. If you have unresolved trauma, consult a trauma-informed clinician about whether and how to include Tonglen. Gradualism. Progress slowly. Start with short segments and with content that feels manageable. Increase length or widen the field only when you notice that your baseline regulation is stable and you're not repeatedly pushed into dysregulation. With that safety frame, let's move into practice. The following 5-minute micro-practice is intentionally simple. It begins with self-soothing because you cannot reliably offer compassion to others if your own system is dysregulated. Use this short practice as a nightly reset or when you need a quick recalibration during the day. 5-minute Tonglen micro-practice. Self-soothing first. Begin by finding a comfortable, upright posture. You can sit in a chair with your feet grounded, hands resting gently, spine supported. If you prefer to practice lying down, choose a position you can remain alert in without falling asleep. Gently bring your attention to your breath. Allow the breath to be natural, not forced. Notice the rise and fall of the chest or the gentle movement of the belly. For a moment, just notice without trying to change anything. Soothing the body. On the next 3 breaths, place a hand lightly on your heart or on your belly, whichever feels calmer. With each in-breath, imagine warmth or softness filling the place you touch. With each out-breath, imagine a small release, a letting go of tension. Breathe in warmth. Breathe out ease. Keep the breaths natural and the scope small. This is self-soothing, not heroic. Anchor phrase. If helpful, use a short anchor phrase to steady attention. Something like, "May I be safe" on the in-breath, and "May I be eased" on the out-breath. Repeat silently, softly, like a friend speaking to you. Bring to mind a small, manageable difficulty, a mild irritation, an area of tension in your body, or a single brief image of stress. This is not the place for intense trauma content. Keep it small. Hold it at arm's length in your imagination. Notice how your body responds. Tonglen cycle. On the in-breath, imagine that you are gently taking in this small difficulty. You might imagine a dark or heavy feeling entering you. The key is not to amplify it. Imagine you are receiving only a small portion, an intentional, compassionate reception. On the out-breath, imagine sending out warmth, ease, or light, something that would reduce the difficulty you just took in. You may visualize the out-breath as softening the hardness, or you may simply sense a wish that ease be present. Repeat this on the next handful of breaths. In, take a small portion. Out, send warmth. Keep the cycle gentle. If at any point you notice your body tensing or panic rising, return immediately to the self-soothing breath and the anchor phrase. This is practice, not exposure therapy. Finish by returning attention to your natural breath for a few cycles. Offer one final inward phrase of kindness to yourself. May I be present, or may I be kind to myself. When you feel ready, open the eyes or lift the gaze. A short commentary on what you just did. You began with self-soothing to stabilize your system. The Tonglen cycle that followed trained a deliberate reversal of avoidance. Instead of exclusively pushing away discomfort, you briefly allowed attention to receive it and then used an intention of warmth to respond. This is less about curing the difficulty and more about changing the habitual stance of reactivity, creating an inner architecture that can hold distress with care. How Tonglen scales and safe ways to extend practice. If the 5-minute practice felt manageable, you can expand gradually. Here are graduated, safe steps. Practice daily self-soothing Tonglen for 1 to 2 weeks, 5 minutes each evening. Notice baseline changes. Is your reactivity softer? Are you sleeping better? Keep a simple log. If stable, practice Tonglen for a loved one. After self-soothing, imagine taking in a small portion of their suffering and sending out warmth. Keep the scope gentle. The intention matters more than graphic detail. Next, practice for a neutral person or a community suffering, for example, people affected by a natural disaster. Use symbolic images or phrases rather than intense sensory detail. Only after you feel steady with those stages should you consider practicing for difficult people. When approaching difficult persons, do so with strong grounding and consider short practices rather than marathon sessions. Clinical and caregiving integration, a case reflection. Returning to Dr. M, her main usage was structured and incremental. She began each day with 2 minutes of self-soothing Tonglen and ended the day with 5 minutes of compassionate breathing. On particularly hard days, she used a brief Tonglen segment before entering a difficult meeting, not to absorb others' pain, but to remind herself of her intention to be present without becoming reactive. Over months, she reported an increased ability to hold boundaries and fewer sleepless nights. This illustrates a core point. Tonglen is a practice of motivation and stance, not of martyred self-sacrifice. Properly applied, it can support clearer discernment and healthier boundaries because it reduces the automatic contraction that leads to either emotional flooding or disengagement. What does modern science say? A compact, sober view. Compassion practices show promising effects on affect regulation, prosocial behavior, and neural correlates of caregiving. Importantly, compassion training can increase positive effect and buffer against personal distress that comes from empathic resonance. This suggests that training compassion can be protective for caregivers by shifting their internal response patterns away from overwhelming personal distress and toward regulated concern and action. Again, evidence is heterogeneous. Some people respond strongly, others less so. For those with complex trauma, compassion training can sometimes increase distress if practiced too rapidly. That's why the trauma-sensitive scaffolding earlier is essential. Troubleshooting common challenges. Feeling overwhelmed or flooded. If the practice triggers panic, dissociation, or intrusive memories, stop. Reconnect with the body. Feet on the floor. 5 slow breaths in the natural rhythm. Look around and name 3 objects in the room. Seek support from a trauma-informed therapist if reactions persist. Numbing or resisting. Some practitioners attempt Tonglen and discover they're pushing feelings away or switching to detached compassion. If you notice numbing, shorten the practice, return to body sensations, and prioritize grounding. The goal is regulated presence, not emotional suppression. Confused imagery. If visualizing taking in suffering feels strange or morally confusing, use metaphoric alternatives. Imagine the in-breath as taking in smoke and the out-breath as sending clean air. Or simply use phrases like, I receive / I send ease. The practice works with intention and attention, not with perfect images. Feeling too responsible. Tonglen can sometimes activate rescuing tendencies. Remember, compassion is not about solving all suffering personally. Your practice is about cultivating a stance that motivates wise action, not toxic over-responsibility. Ethical posture, humility, boundary, and action. Tonglen invites us toward greater care, but ethical action matters. Compassion without boundaries can exhaust. Combine Tonglen with practical action. Set clear limits at work, ask for help, advocate for systemic changes, and practice self-care. Use Tonglen to clarify whether to act, withdraw, or refer. It is not a substitute for advocacy or structural solutions. A 6-week starter plan for sustained practice. Week 1. Daily 5-minute self-soothing Tonglen in the evening. Note immediate effects in a journal. Week 2. Continue evenings. Add a 3-minute morning self-soothing check-in before work. Week 3. After evening self-soothing, extend 1 or 2 nights per week to 10 minutes and practice Tonglen for a loved one. Week 4. Introduce a weekly compassionate pause before a challenging meeting or interaction. Use 2 to 3 breaths of Tonglen to steady intention. Week 5. Add 1 session focused on neutral or community suffering, using symbolic images rather than intense detail. Week 6. Assess. If baseline regulation is stable, consider adding short Tonglen practice for difficult people, always with grounding and limits. Continue journaling and consider integrating a weekly reflective check with a therapist or peer support. Longer reflections. Tonglen and the cultivation of moral imagination. Tonglen is training in moral imagination. It reorients attention from self-protective contraction to intentional reception and altruistic response. Over time, this reorientation can change how we perceive social pain and our sense of agency within it. Rather than a naive, I must fix everything, Tonglen cultivates a spaciousness from which wise action can arise. Practice ethics in community. Finding Sangha and supervision. If you train with Tonglen, consider a supportive community or teacher. Group practice and guided instructions can offer corrective feedback and help you calibrate pacing. If you're a clinician or caregiver, supervision is particularly helpful. Discussing real cases with peers can prevent isolation and boundary erosion. Final practice variation. A modest daily ritual for caregivers. If you work in a high-stress caregiving role, you can use this short ritual daily. 2 minutes self-soothing breath on arrival or before a shift. Hands on the heart, slow natural breath, anchor phrase. 1 minute Tonglen for a brief, specific stressor. Imagine taking in a small portion and breathing out warmth. 1 minute of boundary setting. Silently state a short intention such as, I will be present and I will pace myself, or may I act skillfully and preserve my strength. Conclude with a short stretch and a sip of water. These small sensorimotor gestures reinforce the shift from practice to embodied action. Closing notes on practice and humility. Tonglen is both an ancient method and a modern tool. It is not magical, but it can change the habitual stance by which we approach suffering. It trains attention, motivation, and prosocial orientation. For some people, it will be transformative. For others, it will be one useful skill among many. Always practice with curiosity, caution, and care. If you'd like the one-page protocol or a downloadable guided MP3 of the 5-minute practice, comment protocol, and I'll add the link. If you want precise scientific references or DOIs for the research I mentioned, say send DOIs and I'll fetch them. Thank you for practicing with Beyond the Mind. If this resonated, consider subscribing, saving this video for when you need it, and sharing a short note below. What small practice will you try tonight? The self-soothing 5-minute Tonglen, the daily caregiver ritual, or a week-long experiment? Your experience helps shape future episodes. Selected sources and further reading. Shantideva, Bhattacharya, The Way of the Bodhisattva. Classical Tibetan text introducing compassion practices including Tonglen, Pema Chodron. The places that scare you and start where you are. Accessible contemporary teachings on Tonglen and compassion. Singer T. and Klemekio M. 2014. Empathy and Compassion. Current Biology. Review discussing distinctions between empathy and compassion and implications for effective neuroscience. Klemecki O. M. Leiberg S. Lamb C. and Singer T. 2014. Functional neuroplasticity and associated changes in positive effect after compassion training. Cerebral cortex. Study on neural and affective changes following compassion training. Additional clinical perspectives on compassion training and caregiver resilience are discussed in contemporary reviews. If you want DOIs or direct links to these papers, I can fetch them and add them to the description. Safety reminder: Tonglen is not a substitute for trauma-informed therapy. If the practice increases distress or brings up traumatic material, stop and seek professional support.